Cohen.
And I'm Kayla Williams.
And we're here with the Microbiology News Report of the Week from SUBS. Breaking news just in. Health-associated infections are the 8th leading cause of death in the United States. Kayla, can you tell us more about them?
Yes, health-associated infections, or HAIs, are infections patients acquire while they are receiving care or treatment for other conditions at a healthcare facility. HAIs have increased 36% in the last 20 years, so they have become a very serious issue.
HAIs are so common because of all the microorganisms in the hospital environment, and usually the host already has a compromised immune system that allows their body to be more susceptible to infection. However, the chain of transmission is crucial because nurses and doctors could also pass on the infection due to improper hand washing or improper sterilization or reuse of tools.
According to the Center for Disease Control, also known as the CDC, 40% of the time, healthcare workers do not wash their hands before interacting with patients.
Most commonly, they occur in hospitals, but they're not limited there. They can happen at rehabilitation facilities, nursing homes, and your local physician's office.
On any given day, about 1 in every 31 people are diagnosed with an HAI.
Even more devastating, there was an estimated 687,000 HAIs in the U.S. acute care hospitals in 2015. About 72,000 hospital patients with HAIs died during their hospitalizations.
And now we're going to take it with Alyssa, who is in the field.
Hi, I'm Alyssa Savarino with the Microbiology News, and today we are just outside the local hospital here in Salisbury, Peninsula Regional Medical Center. I am here today with Jessica Thaler, who just recently underwent an appendix removal surgery here. Did you know you were at risk for an HAI while you stayed here?
No, honestly, I didn't know that I was susceptible for an HAI. They didn't make it aware to us, and I was pretty out of it before and after my surgery, so I think that's something that they should make us aware for, because after my surgery, I didn't have the ability to ask them many questions, and they kind of sent me home right away, so I think that they should tell us the signs and symptoms, so at least I know what to look for when I go home.
I agree. Good precautionary measures to prevent HAIs according to the CDC include getting your vaccinations, taking your antibiotics correctly, keeping your hands clean, and talking to your doctor so you can stay informed about your risks. Don't be afraid to ask your doctor questions because they are there to help you. And with that, we will take it back to Claire and Kayla back at the station.
The top 3 most common HAIs, according to the CDC, include central line-associated bloodstream infections, catheter-associated urinary tract infections, and surgical site infections.
The CDC constantly works to monitor and prevent these infections because they are an important threat to the safety of patients. They monitor antibiotic resistance and sound the alarm if new threats emerge. The CDC develops and provides new lab tests so the health departments can easily identify new threats.
It's so good to know that there are people out there looking for us, but always make sure to look out for yourself too. If you want more information about HAIs, make sure to check out the Center for Disease Control's website.
Thank you for tuning in for another breaking story with the Microbiology News.
As stated before, healthcare-associated infections are the 8th most leading cause of deaths in the United States. Unfortunately, the danger of HAIs are not stressed enough, which they should be considering their mortality rate exceeds 10%. HAIs infect 1 in every 31 patients during hospitalization. According to the study of the New England Journal, nationally that ends up being approximately 721,000 HAIs each year, leading to about 75,000 mortalities. Most people relate an HAI to device and surgical-related causes. However, this excludes over 50% of other possible causes of HAIs. With that being said, it is necessary that infection prevention programs be utilized for the remaining 50%. Such programs have been very effective, reducing HAIs in recent years by 68% from the early 2000s. Although rates have dropped drastically, it is crucial to continue research to eliminate healthcare-associated infections. Other issues related to HAIs vary and impact many aspects both financially and medically. For example, HAIs prolong hospital stays, cause long-term disabilities, increase antimicrobial resistance, cause unnecessary deaths, and provide a large financial burden on both affected families and hospitals. The financial costs associated with HAIs add up to about $6.5 billion per year in the U.S. Risk factors of HAIs also vary. However, anyone receiving medical care is at risk of acquiring one of these infections. Although any healthcare patient is at possible risk of an HAI, some people are more susceptible than others. These people include very young individuals, such as premature babies or previously sick children, the elderly, and people with already existing medical conditions such as diabetes. However, even if you are at a lower risk for an HAI, it is in your best interest that you take necessary precautions to adequately prevent yourself from possibly contracting a healthcare associated infection and to keep you healthy.
Thanks for tuning in for another microbiology lab report. I don't know. It's bad. That was bad.
Lab report? Crucial.
I agree. Good precautionary measures are put in ahead
and prevent these infections. And they have an important. What the heck is going on?
Thank you, Alyssa. Thank you, Alyssa.